health equity is really not about health. It's about justice. I came under the specific purpose of helping to develop a mental health outreach strategy. Before I arrived, the center had been principally focused on physical health. Understanding the movement around the reduction in health disparities, the promotion of health equity, we realized that there needed to be a coordinated mind-body effort.
And I heard this little kid, I mean, she was 14 maybe. She was struggling to try to communicate with the person who was trying to schedule her for an appointment. So I offered her to translate, or to interpret, if you will. As it happens, she was 14, she was pregnant, and she was HIV positive. And I asked her, where is your dad or your mom or your brother? And she was alone.
I tell you, some of the most important things I do are done on a Sunday morning when I'm asked to go to some of the local churches and speak about prostate, you know, what we can do for prostate cancer, when people should have blood draws. It's called PSA, which is a screen for prostate cancer. That to me is some of the most valuable time I have. Those are the things that really make a difference to me.
It was an African-American gentleman. And so when I came in to see him, you know, I shook his hand, I addressed him as Mr. I listened to his chest, I examined him. And at the end he said to me, and this is his quote, "I ain't never had a doctor touch me before."
Over 1,000 patients with lung cancer who enrolled in a clinical trial, cooperative group trial, over 1,000 patients, all staged and all treated exactly the same way. And what we learned is that when you stage folks the same way and you treat them the same way with same therapies, you get the same result.
It was interesting because a lot of the primary physicians there had never really thought about their patients not exercising because of their hair.
You know, one of the recommendations from the Institute of Medicine's report was that we needed more minority caretakers.
And that's where the excitement comes in, is that we can design ways to help these women change their lives so that they can decrease these major issues that are affecting these women.
And so many people tell me these stories. I'd love to be able to manage my diabetes. I can't afford the insulin, or I can't afford the medications. I can't afford the blood glucose meter. That's when it becomes personal.
I am a human being. Nothing human can be alien to me. If you really internalize that, then you know that anyone suffering HIV, AIDS, that's me. Somebody suffering diabetes, yes, that's me. Someone suffering from hypertension, yeah, I'm that. I am all of that. And all of my energies must be directed to ridding us, my community, my city, my family, my state, my nation, and the world of these afflictions.
It was 40 years ago that Dr. Martin Luther King Jr. Made his statement about health disparities being one of the great injustices in our society. And so using the phrase health equity gives us hope that those differences can be taken care of, that they can be resolved. And so I love hearing Dr. Angelou talk about health equity because she's so passionate about it, and she gives us that hope as a center that we can make a difference in this area in health.
In my situation, I think that my time here at the university is important if I can help one person through the diagnosis of cancer. I think that if we look at that in a more global view and understand that my time in research is able to help multiple people, not only here at the medical center, but throughout the world, I think that that would allow me to say that my time has been well spent.
We need to make sure that we are ready to roll our sleeves up and go into the community and do the work that must be done. And I think donors should have the strength to fund programs that work to create realities that work to empower human wholeness.
She's 89, she's African American, And she gave me a present because she thought that my behavior towards her was black when I was behaving as a doctor. And I told her, why do you mean I'm black? And she says, you were nice. The blackness or the brownness of a person does not mean a certain language. It means attitude. So that's a message also that we are trying to propagate across the institution. You don't have to be black skinned to come across as black. You have to be a human being.
We have the facility. We have the dream. And so I think that the next step is to give.